There's a hard part of EMDR work that I think we should talk a little bit more about. Sometimes the therapist becomes part of the target, not because we did something harmful or because the work is failing, but because therapy can stir up disorientation, grief, anger, and loss of an old way of coping. So a client may say, ever since we started this, I'm having nightmares, or I started smoking again, or I was doing better before we opened all of this up. And sometimes what they mean is my old way of surviving is not working the way it used to. And I don't know how to live differently yet. That in-between place can feel confusing and chaotic. The symptoms the client was previously experiencing may have shifted or reduced, but now the client is face to face with what was previously numb or defended against or just outside their awareness. So that's not bliss anymore, but it's not failure either. And in that confusion, it can make sense that the therapist becomes the person carrying the blame. I like to encourage humility around this because there may be times when it is clinically appropriate that we need to consider offering ourselves or the client's experience of us as part of the EMDR target for reprocessing. Not because we are agreeing that we caused everything and not because we should become a punching bag, but because the therapeutic relationship may now hold some of that disturbance, and avoiding that doesn't help the work. So in some cases, using the therapist as the target image can help the client work through or make sense of their distress. It can also sort out and clarify what belongs in the present, and then this can make room for a more adaptive understanding of what is happening. And this can also be a really good modeling experience too. A client gets to see that repair is possible, that conflict doesn't automatically mean abandonment. Hello, ghost culture. That naming anger, the client can see that naming anger does not have to destroy the relationship, and that a therapist can stay grounded, curious, and boundaried while still being open to that reflection. And this matters especially when a client has a long history of being a doormat. So when they begin advocating for themselves, it may not come out in a polished or regulated manner at first, right? It may come out sharp, or it may come out as blame, or they may swing from being passive to aggressive before it settles into that assertiveness. And that swing does not automatically mean something is going wrong. Often it means that something adaptive is trying to emerge, right? Because we're trying to find, where's the assertiveness? I'm swinging to aggression. Oh, but where is that middle ground? Passive aggressive doesn't work. Where's assertiveness? So something adaptive is trying to emerge, and it's sometimes in the form of a new kind of self-protection that is still rough around the edges. So our job as therapists is to recognize that adaptive movement and help shape it, not shame it, not personalize all of it, and not permit ourselves to be harmed by it. So the task is a both and, right? We need to honor the client's growth, their growing capacity to speak, to protest, and to take up space. And we need to maintain the boundaries that keep therapy safe and useful. So we do not need to defend ourselves from every projection, and we do not need to absorb every impact without limits. So sometimes the work asks for humility, sometimes it asks for repair, and sometimes it asks us to consider whether we, as the therapist, have become part of the reprocessing that still needs to happen. It's not always easy, it's not always fun, and it can be uncomfortable. But in the right moment, it may be part of what helps the client move from chaos towards integration.